morning. I'm Dr. Rosano Bangasan. I'm an adult and geriatric psychiatrist from Kern County Mental Health. Okay, I'm currently attending our CCPS conference here at Chaminade Resort and Spa. And I believe this is our third year of holding our annual conference here in this place, and it's really an awesome place. Other than practicing adult and geriatric psychiatry, let me also introduce myself that I'm currently the treasurer of the Filipino Psychiatrists Association in the whole North America at present, and I've been holding this position for the past 4 years, and I'm the incoming president of the current chapter of Central Psychiatric Society. Okay. With regards to the question of how do I maintain my enthusiasm for medicine, I think I have a lot to say with that, because my previous practice was purely anesthesia, and I did that practice for about a couple of years after the training. And when I came here to United States, I also am enrolled in the residency program, under the anesthesia program. And my first year of internship basically was all internal medicine. And I also, wanted to do initially after the 4 years of adult training, I wanted to do consultation liaison, but I kind of fell in love with geriatric psychiatry. So whenever there are really ways by which I can connect medicine, and you can visibly see that in my, attachment with my geriatric patients, whom, as we know, has a lot of medical comorbidities, I never forget how to do my internal medicine stuff. Okay. Thank you very much for inviting me. Thank you.
Hi there, my name is Lauren Schur. I'm a psychiatrist at University of California at Davis, and I'm the Sacramento chapter president for CCPS. And I guess the question is, what keeps me enthusiastic about the practice of psychiatry? And there are many things, but I think the teaching of medical students and residents is the aspect of my job which makes me very excited, because I'll go from seeing multiple consultations in the hospital. I'm a consult psychiatrist and psychosomatic medicine, and I get to spend a lot of my time teaching medical students and residents to inspire them to be good doctors and psychologically minded residents as well. So I think that's my brief answer. I also very much enjoy my time with patients. I maintain a small psychotherapy practice in addition to practicing emergency psychiatry and consultation liaison psychiatry. So that's what keeps me inspired.
Excellent. My name is Glenn Zhang, and I am your CCPS treasurer. I work in Sacramento, and I work for UC Davis and for the Sacramento County Mental Health System. So I'm going to answer the question about what are the most important issues facing psychiatrists as a profession. So in my opinion, I think given the current economic crisis, we're often asked to do more, provide more services with less resources. And in my opinion, I think that we can do quite a bit more. And probably the way we're going to do that is to work collaboratively amongst ourselves, working with inpatient, outpatient systems of care, working with more community providers and service organizations, and working with existing grassroots networks, so that we could all achieve our similar goals of serving our community. So again, despite the issues of having limited resources, I think it's an opportunity for all of our different organizations, whether they're professional associations or public and private sector health systems and community nonprofit organizations, to really come to the table and communicate and collaborate. I think the other issue facing psychiatrists is the issues of healthcare reform. I think that as psychiatrists, we're going to have opportunity to really be on the table rather than waiting passively to see what will happen to our profession versus being involved in some of the policies and shaping some of the practices that will happen in the future. So I think those are a couple of hopeful issues that are facing our profession.
Hi, I'm Don Hilty. I'm CCPS past president and the California Psychiatric Association treasurer, and I serve as the vice chair of the program committee for the APA. The most important issue for me in psychiatry right now is access to care for patients, and I particularly work with primary care providers to disseminate care, particularly in rural areas using telepsychiatry. Thanks.
Hi, my name is Shannon Suo. I'm the president-elect of the Central California Psychiatric Society. I'm also the annual planning committee chair for our CME meeting here in Santa Cruz. I've been the social chair for the annual meeting. I've been diversity chair. I also have interests in cultural psychiatry, women's issues, and medicine and psychiatry as a combined trained family medicine and psychiatry faculty member at UC Davis. I belong to the CCPS chapter, CPA, and APA for various reasons. Obviously, I like the opportunities that CCPS and APA and CPA present for leadership and to have a voice in psychiatry, but there's also a lot of things that I feel that our organization can do for me on my behalf. And I think that a lot of the people that I talk to who say they aren't members are relying on the herd immunity. Kind of the same principle that people use to say they don't need to get vaccinations. Well, everybody else is getting vaccinated, so I don't need to. But the truth is, if we don't belong to these organizations, we don't lend strength to the voice that they can have on our behalf. And so we aren't able to be there in the hearings. We're not there at the table to talk about maintenance of certification and what our needs are as professionals and as learners. So the APA, the CPA, and the CCPS leadership can provide that voice for us and be there when we can't be there ourselves to speak for ourselves.
Hello, my name is Robert McCarran. I'm the current president of the Central California Psychiatric Society. Also on faculty at UC Davis as a psychiatrist and an internist, and I dabble a little bit in pain medicine as well. I've been asked to talk about why it's important to be an APA, a CPA, and a Central California Psychiatric Society member. Well, I think there are a couple of reasons. I think the most important reason to be a member of these organizations is camaraderie. And I think we're really experiencing some very difficult times economically. Our patients are often suffering, and it's sometimes a challenge to do what we do and to listen to our colleagues and to talk a little bit about our concerns and our experiences. I think is paramount and helpful. And I think certainly in my mind that's probably one of the most important reasons. The second reason I would say is advocacy. You know, we got to advocate for our patients, and if we're not doing it, no one's going to do it. It's that simple. And so, learning about government affairs, for example, public relations, and learning about what's happening at the national and state level in terms of healthcare reform is going to be very important, increasingly so over the next few years as we see healthcare reform go into effect and take shape. So without any question, I think that really one of the most important reasons for us to join the APA, the Central California Psychiatric Society, and also the California Psychiatric Association is really for the benefit of our patients. Thank you.